So we're stretching the psoas muscle on the right hand side. The psoas muscle is a hip flexor muscle, so what we want to think about doing is extending the hip and going back. So this is a modified lunge stretch. So this is a really, really specific, important stretch, so you have to learn how to stack it, and each part of the stacking process is super important. So you do need to find something to hold on to if you're a little bit unstable, and if you do have some injury to that area or injury to the low back or instability in the low back, you do need to hold on to something. So what you're going to do for stretching this right side, we're putting this right side back because we're extending the hip. So what we want to make sure when we start to do this is that your hips are absolutely centered to the front and they're not open or overly rotated. Okay, from here, you're going to do posterior pelvic tilt into that. If you need to move a little bit forward here, you can bend the front knee, or you can kind of go back this way. So straight, posterior pelvic tilt. Now what you're going to do is intensify the stretch by lifting up the same side arm that your back leg is back and stretching. So the right arm goes all the way up, straight arm with your palm facing the floor till you get to your ear. Then what you're going to do is reach up to the sky, maintaining that posterior pelvic tilt and slightly laterally flexing to the left or the opposite side that you're stretching. Okay, I'm going to do that one more time so that we can stack it. We'll be on the left side so you can see it from this angle. So, stretching the left side, we're bringing the left leg back. We're rotating front, so we're nice and even. We're doing posterior pelvic tilting. You can also lean a little bit forward on that front knee to get a little bit more, but we want to make sure that we remain in a spinal neutral position. We are not doing this. And then we are not doing this. We're spinal neutral, where we're posterior pelvic tilting. We're lifting up the left arm, palm towards the floor, all the way to where you reach your ear. We're reaching up and then laterally flexing away. Maintaining that posterior pelvic tilt.